Superior part of face. We draw a line on the frontal muscle. 39% this is depressing part, another 61 levator part of frontal muscle. And we inject the botulinum toxin to relax the depressor. Then we inject between the eyebrow botulinum toxin in standard doses. We inject the orbital area using the open eyes technique. It is important to understand that there is also a depressor and an elevator in the orbicular muscle of the eye, so we relax the depressor under the eyebrow. Muscle toning. We introduce lateral part of the frontal muscle for elevator eyebrow, and we're using needle 6 mm 30 G, each point 0.5 milliliter. Treatment lower part orbicular oculi. This is a very thin muscle and impossible to insert the needle directly inside the muscle. We introduce liquid inside dermis with formation little papules. We do 3 lines. The first down the eyelash. Second, insertion of the muscle of the bone. Third, between the 2 lines. General doses is 1 milliliter per eye. Then we do a gentle massage for diffusion of the liquid until the muscle. Pregnancy is once every 7-10 days, total of 4 sessions. For support pregnancy is once a month. L-genic. This is the first formula in the world that allows to regenerate adipose tissue and restore lost volume. It contains IGF-1, glucose and glycerol, which use the principle of excessive increase in the volume of adipocytes in order to activate surrounding stem cells and create new adipocytes. In the lateral part of the frontal muscle, there is a lateral temporal cheek fat compartment which decreases with age, and its unworthy volume gives such age-related chins as depletion of the eyebrow tail, wrinkles, and creases. Therefore, we outline the injection zone, the crest of the temporal bone, the hairline and zygomatic area. Dosage is 1 milliliter per 1 square centimeter. Pregnancy of once per month. Immediately after the injection, we will see a good result due to the introduction of additional volume, but after 15 days, we will get the result due to regeneration of adipose tissue. Middle part of face. The zygomaticus minor and the major muscles draws the upper lip up, corner of mouth up and outward laterally, and is the laughing muscle. Determine perpendicular line between temporozygomatic suture and zygomatico-temporal suture. Horizontally line outline the zygomatic bone. This is the first point. Second point, outline the circular muscle of the lips. From the wing of the nose, 1 centimeter laterally and down. Third points, from the corner of the lips, 1 centimeter laterally and 1.5 centimeter upwards. 4 and 5 points in the middle of the distance between these lines. Doses is 0.5 milliliter per each mark, therefore 2.5 milliliter on each side. Also, when correcting this zone, it is necessary to inject botulinum toxin into the muscles that lower the corner of the mouth, depressor anguli oris. Determination of injection points: 1 centimeter laterally and 1.5 centimeter down from the corner of the mouth. Dosage is 2 units. Lips rejuvenation, allogeneic activation of surrounding stem cells, and the creation of new adipocytes, restoring youthfulness and hydration to the lips without changing the natural shape and volume that is determined by natural and genetics. However, we will get the best result if we will combine allogenic with botulinum toxin. Correction with botulinum toxin. Barcode wrinkles correction. Depressor septinae muscle 2-3 units. Along the edge of the vermilion border 2-4 units. Allogenic is injection into the vermilion border of the lips. The dosage is as much as the tissue of the lips can accommodate. In this case, there are 2.5 ml in total. Correction of the lower part of the face. To get a good result in this area, it is also necessary to use botulinum toxin in this area. In this case, we inject the lateral platysma bands 2 units every 2 cm and in 3 locations using 3 units in each one. This is where the platysma is moving into the corner of the lower jaw and pulls the oval of the face down. Also, when platysma is in good shape, it makes the ethnic platysma fold. Therefore, it makes sense to work with the product muscle tonic, M-tonic. We work diffusely intramuscular injection 0.2 ml per every 2 cm between platysma bands from jawline to collarbone. Pregnancy, 1 session for 6 or 8 months is depend the metabolism and the person lifestyle. M-tonic for session 1 times for 7-10 days. Total 4 session. In this case, we injected only muscle toning. As previously mentioned regarding the upper part of face. Upper part of face 0.3 ml each point. Middle part of face dosage is 0.5 ml per each point, therefore 2.5 on each side.